Well, I'm here with the Shadow Minister for Health for the Conservative Caucus, Marilyn Gladu. Thanks so much for joining us on this very important day, Belle Let's Talk Day. Aujourd'hui, c'est le jour Belle Cause pour la cause. Et la santé mentale, c'est très important. Marilyn, I think it's safe to say that every family in Canada has been touched by mental health in some fashion or another. So what have you been hearing as you've been talking to Canadians about this very important issue that's facing us?
Well, Andrew, truly, you're right. 1 in 5 Canadians will deal with a mental health issue during their lifetime. And across Canada, we're seeing a huge increase in addictions, issues with suicide, people who are not able to get mental health services. Either they're not affordable or they're not available. And we have an aging population. So we're seeing the increase of dementia as the population gets older. With issues of stigma and difficulty talking about it, it's great to have Belle Let's Talk Day to help us out with that. But how can the Conservative Party come and help Canadians that are struggling with mental illness?
Vous avez raison, c'est un enjeu qui touche la vie de 1 sur 5 personnes au Canada. Et souvent, les gens souffrent en silence. Too often, people suffer in silence. You know, because of that, you talked about stigma. One of the things that the Conservative government has done in the past is we put a lot of resources into fighting the stigma. That's what today's all about. Let's talk, getting people to be open about it, to reach out to a family member or a loved one or a medical professional. Like physical ailments, there are treatments available out there, and it's important that people recognize that and know that there are support systems. And we all have an obligation, a role to play in providing that support and providing help to people who do reach out. C'est très important pour les gens qui peuvent aider les autres qui ont parlé de leur enjeu. And so one of the things we're working on is, as we move towards developing our policy on healthcare, is to make sure that we're always working with the provinces as we find ways to improve the quality of health services to Canadians, that mental health services are a big part of that.
Je suis certain qu'on va avoir les solutions dans 2019.
You're absolutely right, Marilyn. Our platform will have some great ideas to do just that. So today, aujourd'hui, c'est important d'envoyer le message. Today, it's important to spread the message.
Let's talk.